children. So go ahead to the next slide. I just want to point out behavioral strategy is any response or response style used to address the child's behavior. Like, it doesn't mean a formal behavior plan. It's like, my daughter and I used to have this, I would sign to her from across the room, no TV, which meant that was the consequence if you kept doing what you were doing. It's just a behavioral, like what you're going to do to address the behavior. It's not a formal plan. Okay, next one. So why are they so important? Is because if you use behavior strategies, the right strategies for the developmental level and age, it reduces the risk that a child develops chronic non-compliance or oppositional defiant behavior, or is diagnosed with ODD, that oppositional defiance. So it can be a destiny changer, like educating parents about this, knowing this ourselves. And I actually applied it to the case we have today. And so when we go over that in terms of recommendations, I'll show that. So go on to the next slide, please. I forgot to set my timer.
You're good. You're fine.
No, for myself. Okay.
Okay.
So this was the talk I was at years ago, and it was a gentleman named Russell Barkley, who's really known for his ADHD work, but he also does a lot of oppositional defiant disorder work. And he identified 4 variables that increase the chances of a child engaging in chronic noncompliance, those kids that say no matter what, even if you ask them $1 million. Have you all ever had that kid? Hey, do you want to go do the funnest thing ever? And they're like, no, like before you're even done, oppositional behaviors, like just the opposite of everything you say, and or being diagnosed with oppositional defiant disorder, which in very simple terms is I don't do what the adult ask. So, how does that develop? And so he identified these 4 factors. Next one. Yeah. So I'm not going to go over all of them, because the one I'm most interested in for today's purposes is this disruptive parenting, because it weighs the most in the development of it. And when I say disruptive parenting, also, sometimes disruptive supports in the setting they are in, if we haven't done training with staff on the importance of these developmental levels. So next one, I'm going to go through these really quick because I want to get to the interventions. But disruptive parenting behavior is the most predictive factor in the development of chronic noncompliance, oppositional behavior, and defiance in early childhood. So there is a stage that, every child goes through of testing the no. Like, that's their favorite word for, about 2 or 3 months. They're testing the limits. That's what they're supposed to do. But when that stage happens, and I have a chart kind of going over all of it, then if we don't make the shift in how we're dealing with them, that's how the defiance develops. So go through the next one. So next slide.
I'm sorry.
It's okay. So when I say parent, I refer to like primary caregivers, legal guardians, foster parents, grandparents, and highly trusted adults involved with the child's care. Because a lot of times if a child is at daycare 10 hours of the day and those providers don't make the shift, you can see the same problems develop. So some of the problems, and you guys have seen this with parents, parents failing to use any behavioral strategy to address the child's behavior. There's nothing wrong. They're fine. They're not hurting anything. Not my child. They would not. They use strategies in an inconsistent or indiscriminate manner. Yesterday it was laughed at. Today I got a spanking for it. The next day, you take something away. They just can't predict. And I will, to my dying day, say kids just want predictability. They just want to figure it out. So this kind of goes with that not making the shift, which I'll show you exactly what stages we make what shifts in just a second. Okay, next one. Okay. Parents using the strategies in an inappropriate manner. Strategies are extremely negative or extreme intensity or used for an overlong time. My mother once grounded me for a month. There was no way she was following through with that. She was a widow with 7 children. It was a good try. You know, I was out of there pretty quickly by about like 2 days because I wore her down. But she also, now it is a northern accent, she also had, you know, we didn't have switches, we didn't have paddles. She had what was called a cat nine tail, or a cat o' nine tail is what it's called. That's your father's belt cut into strips. So we were fast. She usually didn't catch us. You could learn to go under the bed, but it was now it would very extreme intensity. I can, just like with a lot of your parents, I can completely now as an adult understand what my mother was doing. She was a widow with 7 children. You know, she was just trying to like figure out, live to fight another day. But the impact of that, you know, I mean, can be for some kids not learning inappropriate behavior, like more defiant behaviors. Strategy have too low of a positive focus or too low in intensity or too short in duration. Again, they might like try, okay, I did something, I turned the TV off for 2 minutes, like, and the child, it's not anything that's meaningful to the child. Okay, and then the next slide. Parents failing to use strategies that are developmentally appropriate. And what I mean by that, the biggest, like, great example would be, I'm going to put a 9-month-old in timeout. Cognitively, socially, that's not going to make the connection. Like at that point, we're using more redirective and environmental manipulation, like moving things that cause problems, and not consequence driven. But the other part of that is if we stay in redirection and don't shift to consequence-based strategies or mix them together, that's one of the biggest ways that the oppositional behavior is developed. So parents not identifying developmental timeframes crucial for the shift to other strategies. And we all do it. Like I did it, not necessarily with behavior strategies, but I remember once giving an adaptive scale to a parent, and it was like at 3, they're supposed to drink from a cup without a lid, or 4, something like that. And I'm like, it was just easier to put the lid on both my kids' things, and he's 6 and can't do it. Like we get into our routines of how we respond to things and we don't know to make the shift. But with behavior, it's really important. So I'm going to go and show you by specific time frames and stages of development. Next slide. Okay. Oh, not making the shift. So I call it parent directed strategies, and I'll give you some examples to parent implemented. Like parent directed is the parent's in charge of it. Like I have to move the dangerous thing out of the way. Parent implemented is I'm following through with a consequence after it. Okay. And that's the most impactful skill deficit if you don't make that shift. Next one. So, you know, I taught developmental psychology at the other college that I'm not allowed to mention for a long time as an adjunct faculty. So most people, if you're in with kids, you know that there are cognitive stages of social development, and these shifts align pretty well with them. I'm only going up to 3-year-olds because that's been our focus. One of my goals is to carry this out more and finish these tables to reflect the older ages too. Okay, next slide. Okay, so the age range, cognitive and social development. So again, you could have a kid with a significant disability who is functioning cognitively and socially in this range, and this is how we want to deal with them. Okay. This is very different. Again, my mother was a widow with 7 children. It's different with what I grew up with. It's different than a lot of us had been taught. But at this stage, and a lot of you've worked with kids with attachment issues, it's because with many people taking care of them or inconsistency in care, nobody promptly responded to their needs during this time period. And it is essential for establishing attachment, trust, and a sense of safety. I don't care if they're 6 months, 1 day old, you can let them cry it out. I don't love that anymore, but you can do it. But at this kind of time frame, that crying it out is essentially like us going to our girlfriends when we're upset and them saying, I can't help you, I can't listen to you. But you're a little kid, and that's kind of what you know. So that's an important point for me, is that this is, when my daughter didn't sleep through the night, I'm telling you, at 9 months, it was July 4th, and we had Independence Day, and she was going to cry and learn to sleep in her bed, right? But before that, I wouldn't do it because I wanted her to understand adults meet your needs, and that's what babies need to learn. I will also say, I think it's really important to say, and there was somebody last cohort who was brave enough that we had really great conversations about this on some of our talks. These stages are not hard, concrete, like rules. I jokingly said 6 months, birth to 6 months, 1 day. That's not it. And there's cultural variation in how the strategies are presented and carried out, and the ages. Just like toilet training, I can tell you developmentally which cultures train earlier and which cultures train later and which methods they use. All of that is okay, but there just needs to be an awareness that there needs to be a shift. We don't all have to use the same methodology or the same words. And I love that somebody was brave enough to say, essentially, the white behavior consultants that we all use tell us to use words that we would never use. And I'm like, I love that. Please tell me that so I can make it useful for you. So that's the same thing here. I might tell you to use a strategy, and you're like, that's not one. Like, what about this? It looks close, but this is what I would more naturally do. And that's fine. Okay, next next page. So then at 6 months, we're going to make a shift. We're not going to be, you're the world, we're going to meet your needs. So next slide. Okay, so 16 to 18 months, approximately, again, we're going to use parent-directed strategies. Like environmental manipulation. So all that is a big fancy word for we're putting away dangerous things, right? We're not going to have things like, cleaning supplies or things you're going to mouth that are dangerous out. Redirection, again, just that's mom's book. Here, you can have this book and give them the hardbound book they can have. Clear boundaries, sometimes with supports, like putting a child in the car seat, like that is we talk about that sometimes, that people consider that restraint. It's a clear boundary. That's a have to do at that age. And so that's really important. I think parents labeling out loud what the expectation is. Hey, sitting in your car seat's a have to do, so to keep you safe, not a whole lot more, but hey, I expect that you chew, or you only put your passy in your mouth. You're saying it out loud so they understand it. High rates of supervision and engagement at this age, you all know that. We don't leave 6 to 18 months alone. introduce no for behaviors that impact safety. In my world, I have no more than 5 no's with any child, because after that, it is ineffective, right? And my no's are things that are dangerous, like electrical outlets, going in the street, leaving without me, the stove, right? And very early on, the 5 no's were the one thing that I recommend having a consequence for, because I want them to understand those are not safe, right? But if we have too many no's, and that's what happens to kids who become oppositional, no just becomes a cue word of what they're going to do is going to bother the stew out of you. Okay. And that's kind of fun because, again, I'm looking for that predictability and control. So so some of you ask a lot of times people say, what do I use? Not a choice, try again, or I'll just block what they want. It's the same thing as no. But most of the times I tell providers, if no had worked, because we have too many of them, we wouldn't be meeting about like behavioral needs. I also like this concept of have to do's, and I introduce it at this age. You know, I know you don't like you getting your diaper changed. It's a have to do. It's like a non-negotiable. You have, yeah, you don't want to hold my hand when we go out to the car. It's a have to do. Brushing your teeth. Again, I don't do more than 6 or 7 of these. Otherwise, they lose their meaning. But at this stage, it's parent directed. Okay. Shift, because I know I'm going long.
You're fine.
Okay. Yeah. Next is a mixing shift. So it's pretty much I'm using redirection and consequence pretty evenly, 40, 60, and it's a gradual shift. It's not like all of a sudden you wake up and you're in boot camp with consequence rules. So go to the next one. And this is like 18 to 24 months, okay? So limit setting with specific expectations. First, then, which is different than if then. First means this comes first. First eat dinner, then down. Okay? If then it starts to, you're just trying to let them know the sequence. You got to do the thing you don't like, then we'll do the thing you don't like. And then we do some consequence focused strategies because we're going to continue the high rates of redirection, but with a shift to then consequence focused strategies that are brief, like brief removal of a preferred item. I prefer item timeout versus child timeout because I don't have to fight an item. So I get clear bins and kind of mount them to my wall, and I just take what you like and I put it up, and I'm like, I'm setting the timer. It's in timeout. You can have it when we're done, because that way I'm not fighting with you to get you back in timeout and giving you all that attention, right? Reprimanding and prompting for what you want. So, if they hit a kid, a better way is, can I have it? If they tell you no, a better way is, I don't like that. I'm sure, thanks for telling me you have to do it. It's a have to do, but you want to start providing them the better words at that point versus just saying no. I've talked to a lot of kids with language delays, and they said, I wish I didn't know if they knew what I wanted, and I was mad that they didn't tell me how to get it the right way. So, and this is where, I would not be a behavior person if I didn't mention that we need that high level of positive reinforcement for desired behaviors. I like high rates of positive reinforcement for that was a smart choice. That was really like brave to do that. That was that was kind. Like I like labeling, like that was kind to share with your friend. I know it's hard. So I think out loud labeling that, and it doesn't come natural. We are not programmed to identify positive things, guys. We are a society focused on finding the mistakes or errors. It's just funner this way. Okay. And by the way, if you're a society focused on finding mistakes and errors, there's a typo in the slide after 2 slides from this. So go ahead, Michelle, shift again. And then Go ahead. From that, it should be 24 to 3 years. Okay, so that's my error right there. I caught it. Then we're going to focus on the proper balance with more emphasis on consequence driven. So this is if then. Like, if you do this, then you can have it. It's different than first then. Removal again, less positive. Everything doesn't need to be reinforced as positive at this point. Just, you sprinkle it throughout the day. This is where we start to do loss of access to an activity or an item, loss of privilege. You'll go to the playground late, or you won't go to the playground, or the TV's turned off. This is where we start not just like a brief removal, like you lose things. It's that if then. If you do that, then you can't play in this area. So that's that shift from I'm just redirecting and to, hey, I'm going to give you specific consequences for the behavior. And these are the important shifts. Again, if you're doing some parent training or parent work or presenting to parents, hey, so many times I'll have kids in our preschool who will hit, and they'll be like, oh yeah, like we removed the other kid and we gave him something else to do. And I'm like, okay, he's 4. What's the consequence for that? And it's like I've said a naughty word or something, ooh, what's the consequence for that? Yes, because this is how they understand the limits are developed in that way. When they're younger, it is not appropriate. One, they don't connect cognitively the consequence to the event, but that's more of a teaching, like what you should be doing, period. When I know a kid has it, like I think for them to understand the parameters of socially functioning in our world, that's when this consequence has to happen. And that's what Barkley says. The failure to do that, or the failure to make that change at the right time, we wait until you're 6, and now we're like, okay, we're serious. At that point it's too late, right? Because they've had a history of those oppositional behaviors. Okay, I think, go ahead, Michelle. Yep. Then I said pause because I'm going to get to 3 to 4 and 4 to 5. And as if I will share that with Michelle as I get those done, just for people to have. And then next slide. Questions, comments, or clarifications. Please ask me questions, guys. Or type them in the chat.
Does anybody have any questions, any clarifications, any
Does it make sense? Like, have people ever seen parents or yourself or staff you work with get stuck on one way of doing it that might, like, doing the consequences too soon? They're like 10 months old and they're trying to use concept, or just more and more I see people getting stuck in the redirection.
Yes.
Like phase, and I hear y'all say that a lot, like we redirect them, right? And there's kind of not a learning for, it's sort of like if you're late for work over and over again and your boss talks to you once or twice, that's kind of like your redirection, like the reason we need to be there here, this. But like the 3rd or 4th time, like you're gonna keep doing it if there's not a consequence, right? And I think it's almost, kids thrive on predictability, and gradually introducing that and making that environment very much a predictable, these are the things that happen. I like to say in session, you make great choices, all the good things come to you. Like, that's up to you, right? And I'm working with 2, 3, 4, and 5-year-olds. I don't necessarily say it that way to 2-year-olds. But I'll show you when if I have like a 1-minute video clip, Michelle, when we get to the specific case we're talking about, if we can share. So I can kind of show you that. So, but I just think sometimes we get so focused on what do we do with this kid and we forget what do we do by age or functioning level. So thank you all.